Dr. Stephen Spann is a family physician, leader, educator, and researcher, the founding dean of the University of Houston College of Medicine. Dr. Spann has also dedicated his career to improving health and healthcare around the globe by training future healthcare professionals, contributing to so many different facets of medicine. Doctor, welcome. It's good to have you here.
It's good to be here.
And he's also the founding dean of the new medical school at the University of Houston.
That's right.
Houston's very excited about that.
Well, it is exciting. We received our accreditation last week.
Yeah. And you told me it's going to be quite competitive to get into those 30 spots, right?
Well, we have over 1,800 applicants in 1 week. I suspect we'll hit at least 2,000, maybe 2,500.
Well, if it were me in medical school, I wouldn't have a chance, I can tell you that. So, Dr. Spann grew up on the mission field. I don't know if you knew that, Chuck, but tell us a little bit about your bicultural heritage.
So I was blessed to grow up in a missionary family in Uruguay in South America. I moved to Latin America when I was almost 7, stayed till I came back to college at age 17. Really did all of my primary and secondary education in Spanish, so I'm very bilingual and very bicultural. It's fascinating because physician colleagues have observed me taking care of patients who are Anglo and Hispanic, and have said, you know, you're really a different person when you're taking care of the Hispanic patient. You're much more warm and animated.
Yeah.
And then colleagues have watched me teach in English and Spanish. I was in a conference in Buenos Aires, Argentina one time, and I did my lecture in Spanish. There was simultaneous translation for English for the English-speaking people that were there, and I sat down after my talk, and one of my American buddies said, you know, I've heard you speak in English many times. You're really different when you do this in Spanish. So it's fascinating.
Yeah, dual personalities maybe.
Dual personalities.
What did your parents do? Were they?
So my parents were church planters,
Okay.
And my father pastored, planted churches. It was a great experience. I really got to see God's hand at work in country and in the city and in neighborhoods that really had very little contact with the gospel.
Mm-hmm. And then you went to medical school, you trained in family medicine, but you also practiced for years in a rural environment.
That's right. I was called to medicine as ministry at a very young age. Always saw myself doing primary care, residency in family medicine. Spent 4 years doing rural family medicine in Arkansas for 1 year, and then North Carolina for 3 years. Great experience, great opportunity to learn, and then I decided to teach full-time and went into full-time medical education.
And where did you go from there? Where did you start that?
Started at the University of Oklahoma. I spent 8 years there. Then I came back to Texas, my home state. Spent 7 years at UTMB Galveston as department chair. Then came back to my alma mater, Baylor College of Medicine, where I spent 16 years as department chair.
And then you went to the UAE?
Then God called us to the Middle East to be salt and light in that part of the world. We lived in the United Arab Emirates, the city of Al Ain, and the Emirate of Abu Dhabi. I worked there for Johns Hopkins as chief medical officer of a large teaching hospital. Was able to teach just about every day. It was a great experience.
And you had, what you don't realize about that particular area of the world, you had many, many nations gathered right there.
I had physicians from over 50 countries that worked with me. And, you know, 80% of the population of that country is immigrant, is expatriate. We literally had people from all over the world whose lives we touched.
You also had you've always had a passion for missions, but you also had a big ministry was it in South America?
So over the years, because of my bilingual and bicultural gifts, I've had the opportunity to teach and consult all over Latin America, every Spanish-speaking country in the continent.
That's amazing.
Worked with medical schools, with ministries of health, with healthcare systems. Have trained over 150 Latin American family physicians to be teachers of family medicine. So it's really kept me in touch with my adoptive homeland and my adoptive culture. Again, just a wonderful, wonderful opportunity.
You know, Chuck, what you may not realize, though, is that you don't have to go to a far-off country to do missions work. Dr. Spann, several years ago, started an organization, it's represented here right now, that ministers to indigent populations as far as their health care right here in Houston. So I'm a real big proponent. Jesus said, go to Jerusalem and then Judea and Samaria and then the uttermost parts of the world. Tell us about that endeavor.
So Casa del Buen Samaritano is a faith-based clinic. It's a partnership between West University Baptist Church and Iglesia Oreb, Southwest Houston. And we provide care to patients who simply don't have medical insurance or the means to seek medical care. It's free of charge, staffed by volunteers from really multiple churches, including Lakeview. And we minister very holistically to really mind, body, and spirit. They receive medical care, they receive spiritual care. Every patient not only sees a physician, but sees our spiritual care team. Last year we saw 3,000 visits. 75 of those patients came to faith in Christ.
Wow, that's amazing.
And it's a great place to learn. We have students from various health professions, disciplines. It's a great place to minister to the needs of people.
And there's plans to expand it too.
We're hoping to expand. We're likely going to move into a different facility close by. But our vision is to involve other churches, other communities of faith that come alongside us. I think there's such a need. 27% of our population is uninsured in Houston. Such a need for care, such a need for holistic care. And I have this vision that we could form teams of Christian physicians from a number of churches, have sites in several places, and really meet the needs of this population.
Make a difference in their own city.
Make a difference. This is the most diverse city in our country. We have people here from all over the world. About 30% of our population are immigrants. In some geographic communities, 60%. Opportunities to share the good news through the healing touch of Jesus' love all over the city.
160 languages are spoken every day in Houston. I tell everybody, you don't have to go to Africa to be a missionary. Just love your neighbor.
That's right.
You know, love the guy, your taxi driver, Uber driver. Love the guy at the grocery store, because they're everywhere. One thing I love about you, Dr. Spann, is that you've never compromised your faith. This is a healing profession that was started with Jesus, and that's the way you see that. I heard you gave a talk on that at a meeting recently, CMDA meeting. And can you just expand on that? Because that's just a beautiful representation.
So he is a great physician, and I tell patients, he's a great physician. I just work for him. We just work for him. We are his hands and his feet.
Right.
But the scriptures are very clear that he calls us. Scripture says that he sent out his disciples to share the good news and to heal the sick. And I think those are intricately linked. I think that when people are in need, when they're hurting, they're more open to the good news.
Absolutely.
And we are his hands. And we heal in his name. He really does the healing.
Yeah.
We just are here to be
treat.
a part of that, to treat. And so I think he calls us to do that. And I have to say, I don't think you have to be a healthcare professional to be a healer.
Yeah.
So many needs and so many lonely people.
Yeah.
43% of the elderly population in this country is lonely, and loneliness increases your risk of mortality by 45%.
Yeah.
So many people who are depressed and stressed and anxious and will respond to a listening ear and a healing touch. So many people that are hungry, so many people that are needy. There's so much we can do to be instruments of Christ's healing with people around us.
You know, the theme of the conference this year is "Can you see it?" And you don't have to look far to see the needs. I mean, they're everywhere.
We're surrounded by needs, and our prayer should be that God would help us to see and recognize the needs, and then reach out and touch people with his love.
how is the University of Houston Medical School going to be different? Because when I heard you talk about this, it was very inspiring. This is going to be a different approach.
So our focus is different. One of our goals is to train more primary care doctors because we need that. We would hope that about 50% of our graduates would choose a primary care specialty, but our graduates will go into all specialties. We will have a focus on caring for the underserved. A lot of emphasis in our curriculum on social determinants of health, on health disparities, on working with our geographic communities in this city that are numerous and have major health disparities, finding ways to work together with communities to improve their health and health care. Our students will not only work in inner city communities, every student will spend a 4-week rotation in rural Texas.
That's awesome.
We have a desperate need for doctors in rural America, rural Texas. So a real emphasis on meeting the needs of people, meeting the needs of the population. We also will emphasize relationship-centered care. Jesus was the great role model. From him we learn that healing requires compassion. You know, there's this new book out called Compassionomics, and it's an evidence-based review of the importance of compassion in our healing relationships. It's very clear that compassionate relationships between healthcare providers and patients leads to better outcomes, lower cost of care, more satisfied patients, and more joy in the provider. And I think we have to role model compassion for our students and emphasize the importance of taking time to establish compassionate relationships with patients.
Yeah, that's beautiful. Your class size is 30 to begin with?
30 to begin with. We'll double every 2 years till we reach a final size of 120, but 120. We'll be 30 for 2 years and then 60 and then
It's like the number in the upper room.
That's right.
That's right. That's amazing. Well, listen, Chuck, any questions?
Well, Dr. Spann, I was just going to ask you, Paul had mentioned that you've been part of the M3 conference really kind of since the very beginning. How have you seen the benefit for you, for students, for peers, people that you come across?
Well, I really love coming because it recharges my batteries, and it just reminds me of the needs and the opportunities that we have to be instruments of God's healing. So I just personally am uplifted and blessed by coming here. I think it's very important for students. We have University of Houston pre-med students here today, and next year we'll have medical students here, but they've learned so much, and they're blessed and they're motivated. And I think by being exposed to this conference and seeing the needs around the globe and seeing how those needs can be met and how we can be instruments of God's healing, that opens people's minds to God's calling.
Yeah.
And I really think we're all called.
We are.
And we're called to be instruments of His healing wherever we are. But it makes us aware of the global needs and the global opportunities to serve Him.
Yeah. That fits perfectly, Dr. Paul. It's like, what is the mission of M3? Connect with others, be inspired, find your mission.
Yeah.
That's exactly what you're talking
What
about.
I appreciate about Dr. Spann is, like Don Stevens, these guys, he's a little older than I am, with gray hair, who've been a long obedience in the same direction. They inspire us that are right behind them to finish well, to finish strong, to look for the next mountain. And anyway, Dr. Spann, we're glad you're a part of this.
I'm so glad to be here.
Yeah, thank you.
Thank you for coming by, Dr. Spann, and thank you for watching us here. This live stream coming to you from Lakewood Church in Houston, Texas. We have a lot more. Don't go away. We'll be right back.